And I think it's often hard to, you can often get lost in the healthcare system about your first principles, because the truth is we have a variety of problems in the American healthcare system. It is fragmented, right? It is also true that prices are just higher in the U.S. healthcare system than elsewhere. So it's not, we do have a volume problem, but we also have a price problem. So there are a variety of challenges that we have to address. And the truth is that we have a system right now of innovation in which there are various models that are being experimented with that are addressing different kinds of problems. So the ACOs are pretty good at addressing fragmentation, but they could be driving up cost. Right, so we do have to be, vigilant, essentially, about not doing things that are really a counter to our purpose. And our purpose at the end of the day is to always, the first, second, and third priority is improving quality, and we definitely want to lower costs. And the great thing about the healthcare system is you can do both of those things. So we should be worried about ACOs that simply, create market, basically market monopolies, and we don't want to see that. And that is we do see that in certain areas of the country where people are concerned that there are not enough insurers, and there's not enough competition for insurers. Sometimes we have a problem that there are just not enough hospitals or not enough doctors or competition between prices, and we need to be worried about competition throughout the healthcare system. But an important part of this is if we have greater transparency throughout the healthcare system, it'll be easier for us to understand what those market problems are.
How do you make sure that you're talking about transparency, data. Mm-hmm. How do we make sure that physicians, that hospitals have the right kind of data? What data do they need? What data do we currently have? And mm-hmm. what are the challenges to getting this kind of data in place currently?
Well, I think there a lot of people were enthusiastic about the data that's been recently reported around hospitals, and it's very interesting that there are hospitals within 100 miles, not 100 miles, within a couple of miles of each other that are charging dramatically different amounts of money. Now, part of that is because the healthcare system is one in which, hospitals are forced to subsidize care, and it's because we have a system where a lot of people don't have health insurance, and hospitals have to own those prices. But I think, having greater transparency across the system is really important. So I do think it's important that we have transparency of what hospitals are charging, doctors are charging, what the whole system is, what everyone's charging. Now, a lot of people believe that, if you just arm consumers with information, that will radically restructure the healthcare system. And I think we should also be wary, because we have had experience over the last several years where information alone is not enough. And also having skin in the game has not been enough to lower healthcare costs. We've had a lot of cost sharing. Consumers are paying a lot more. That's one of the biggest changes in the healthcare system over the last 10 years, is that consumers themselves pay a lot more. And yet we weren't experiencing a lot lower costs as that was happening. We're experiencing lower costs, in the last few years where we've seen different kinds of transformations. So.